Can a hospital or healthcare institution be sued for sexual abuse by a doctor or medical staff? It happened in a medical setting, where you were the most vulnerable you have ever been. Here is what the law says about institutional accountability. Sexual abuse in healthcare settings is among the most profound violations of professional trust that exists. Patients who come to hospitals, clinics, and medical offices are at their most vulnerable, often in pain, often frightened, often partially or fully disrobed, and utterly reliant on the professionalism and ethics of the people providing their care. When a doctor, nurse, or other healthcare provider violates that trust through sexual abuse or assault, the individual perpetrator is criminally and civilly responsible. But so, in many cases, is the institution. Healthcare institutions can face liability for sexual abuse by their staff under several legal theories. If the institution had complaints or warning signs about an employee and failed to act, or actively suppressed those concerns to protect the institution's reputation, that failure can give rise to a negligence claim. If credentialing processes failed to reveal prior incidents at other institutions, that is a potential negligent credentialing claim. If inadequate supervision policies allowed solo, unwitnessed patient contact in circumstances where protocols should have required a chaperone, that is a systems failure. According to data from the Federation of State Medical Boards take disciplinary action against physicians for sexual misconduct every year. Research published in JAMA Internal Medicine has found that physicians disciplined for sexual misconduct in one state have sometimes continued to practice in other states. A systemic failure in the credentialing and reporting infrastructure. One of the most underreported and underlitigated areas within this topic: sexual abuse during sedation or anesthesia. Patients under sedation are entirely unable to report or resist abuse in the moment. Multiple documented cases have involved medical providers abusing patients in exactly this circumstance. Our firm has represented survivors of healthcare institutional sexual abuse with full sensitivity and experience for decades. If you were abused in a medical setting, please call us. This call is confidential and you deserve to know your legal rights. We offer 100% free consultations by calling 855-566-3752, or you can visit us online at www.isajslawyer.com.